Autism spectrum disorder. Autism spectrum disorder in the International Classification of Diseases 11th revision, ICD-11, incorporates both childhood autism and Asperger's syndrome from the ICD-10 under a single category. Characterized by social communication deficits and restricted, repetitive and inflexible patterns of behavior, interests or activities. Guidelines for autism spectrum disorder have been substantially updated to reflect the presentations throughout the lifespan. Qualifiers are provided for the extent of impairment in intellectual functioning and functional language abilities to capture autism spectrum disorder in a more dimensional manner. 6A02 Autism spectrum disorder essential features. 1. Persistent deficits in initiating and sustaining social communication and reciprocal social interactions that are outside the expected range of typical functioning given the individual's age and level of intellectual development. Specific manifestations of these deficits vary according to chronological age, verbal and intellectual ability, and disorder severity. Manifestations may include limitations in the following: understanding of, interest in, or inappropriate responses to the verbal or non-verbal social communications of others. Integration of spoken language with typical complementary non-verbal cues, such as eye contact, gestures, facial expressions and body language. These non-verbal behaviors may also be reduced in frequency or intensity. Understanding and use of language in social contexts and ability to initiate and sustain reciprocal social conversations. Social awareness, leading to behavior that is not appropriately modulated according to the social context. Ability to imagine and respond to the feelings, emotional states, and attitudes of others. Mutual sharing of interests. Ability to make and sustain typical peer relationships. 2. Persistent restricted, repetitive, and inflexible patterns of behavior, interests, or activities that are clearly atypical or excessive for the individual's age and the sociocultural context. These may include lack of adaptability to new experiences and circumstances, with associated distress, that can be evoked by trivial changes to a familiar environment or in response to unanticipated events. Inflexible adherence to particular routines, for example, these may be geographic such as following familiar routes, or may require precise timing such as mealtimes or transport. Excessive adherence to rules, for example, when playing games. Excessive and persistent ritualized patterns of behavior, for example, preoccupation with lining up or sorting objects in a particular way, that serve no apparent external purpose. Repetitive and stereotyped motor movements, such as whole body movements, for example, rocking, atypical gait, for example, walking on tiptoes, unusual hand or finger movements and posturing. These behaviors are particularly common during early childhood. Persistent preoccupation with one or more special interests, parts of objects, or specific types of stimuli, including media, or an unusually strong attachment to particular objects, excluding typical comforters. Lifelong excessive and persistent hypersensitivity or hyposensitivity to sensory stimuli or unusual interest in a sensory stimulus, which may include actual or anticipated sounds, light, textures, especially clothing and food, odors and tastes, heat, cold, or pain. 3. The onset of the disorder occurs during the developmental period, typically in early childhood, but characteristic symptoms may not become fully manifest until later, when social demands exceed limited capacities. 4. The symptoms result in significant impairment in personal, family, social, educational, occupational or other important areas of functioning. Some individuals with autism spectrum disorder are able to function adequately in many contexts through exceptional effort, such that their deficits may not be apparent to others. A diagnosis of autism spectrum disorder is still appropriate in such cases. Additional clinical features: autism spectrum disorder. 1. Common symptom presentations of autism spectrum disorder in young children are parental or caregiver concerns about intellectual or other developmental delays, for example, problems in language and motor coordination. 2. When there is no significant impairment of intellectual functioning, clinical services may only be sought later, for example, due to behaviour or social problems when starting school. 3. In middle childhood, there may be prominent symptoms of anxiety, including social anxiety disorder, school refusal, and specific phobia. During adolescence and adulthood, depressive disorders are often a presenting feature. 4. Co-occurrence of autism spectrum disorder with other mental, behavioral or neurodevelopmental disorders is common across the lifespan. In a substantial proportion of cases, particularly in adolescence and adulthood, it is a co-occurring disorder that first brings an individual with autism spectrum disorder to clinical attention. 5. Pragmatic language difficulties may manifest as an overly literal understanding of others' speech, speech that lacks normal prosody and emotional tone and therefore appears monotonous, lack of awareness of the appropriateness of their choice of language in particular social contexts, or pedantic precision in the use of language. 6. Social naivete, especially during adolescence, can lead to exploitation by others, a risk that may be enhanced by the use of social media without adequate supervision. 7. Self-injurious behaviors, for example, hitting one's face, head-banging, occur more often in individuals with co-occurring disorder of intellectual development. 8. Some young individuals with autism spectrum disorder, especially those with a co-occurring disorder of intellectual development, develop epilepsy or seizures during early childhood with a second increase in prevalence during adolescence. 9. Catatonic states have also been described. A number of medical disorders such as tuberous sclerosis, chromosomal abnormalities including Fragile X syndrome, cerebral palsy, early onset epileptic encephalopathies, and neurofibromatosis are associated with autism spectrum disorder. 10. Genomic deletions, duplications and other genetic abnormalities are increasingly described in individuals with autism spectrum disorder, some of which may be important for genetic counseling. Prenatal exposure to valproate is also associated with an increased risk of autism spectrum disorder. 11. Some individuals with autism spectrum disorder are capable of functioning adequately by making an exceptional effort to compensate for their symptoms during childhood, adolescence or adulthood. Such sustained effort, which may be more typical of affected females, can have a deleterious impact on mental health and well-being. Specifiers, for characterizing features within the autism spectrum. Specifiers enable the identification of co-occurring limitations in intellectual and functional language abilities, which are important factors in the appropriate individualization of support, selection of interventions, and treatment planning for individuals with autism spectrum disorder. A qualifier is also provided for loss of previously acquired skills, which is a feature of the developmental history of a small proportion of individuals with autism spectrum disorder. Co-occurring disorder of intellectual development, individuals with autism spectrum disorder may exhibit limitations in intellectual abilities. If present, a separate diagnosis of disorder of intellectual development should be assigned, using the appropriate category to designate severity, i.e., mild, moderate, severe, profound, provisional. Degree of functional language impairment. The degree of impairment in functional language, spoken or signed, should be designated with a second qualifier. Functional language refers to the capacity of the individual to use language for instrumental purposes, for example, to express personal needs and desires. This qualifier is intended to reflect primarily the verbal and non-verbal expressive language deficits present in some individuals with autism spectrum disorder and not the pragmatic language deficits that are a core feature of autism spectrum disorder. Loss of previously acquired skills. A small proportion of individuals with autism spectrum disorder may present with a loss of previously acquired skills. This regression typically occurs during the second year of life and most often involves language use and social responsiveness. Loss of previously acquired skills is rarely observed after 3 years of age. If it occurs after age 3, it is more likely to involve loss of cognitive and adaptive skills, for example, loss of bowel and bladder control, impaired sleep, regression of language and social abilities, as well as increasing emotional and behavioral disturbances. Based on specifiers of intellectual functioning, functional language abilities and loss of previously acquired skills, autism spectrum disorder is further classified into following subgroups. 6A02.0 Autism spectrum disorder without disorder of intellectual development and with mild or no impairment of functional language. 6A02.1 Autism spectrum disorder with disorder of intellectual development and with mild or no impairment of functional language. 6A02.2 Autism spectrum disorder without disorder of intellectual development and with impaired functional language. 6A02.3 Autism spectrum disorder with disorder of intellectual development and with impaired functional language. 6A02.5 Autism spectrum disorder with disorder of intellectual development and with absence of functional language. Thanks for watching.